Hello everyone, this is Shadi Reis from CVI 2023 in Austin. I'm really privileged today to be with Dr. Sandeep Banga. He is currently a third-year fellow but going for interventional. Dr. Banga, thanks for being with us.
Thank you for having me here, sir.
Thank you. So you are almost finishing your general cardiology and you're going to interventional. And we spoke offline about the importance of multidisciplinary kind of training in your interventional year. Yeah. So tell us a little bit about your thoughts.
So I'm actually presently working at Sparrow as a fellow, and I feel like, the whole of the training should involve all the spectrum, like including your coronary, which is a major stuff and bread and butter of the interventional fellowship. And I also feel like, peripheral intervention is a major part of the, of the training, because I have seen people having complications, having issues with access in patients who have peripheral vascular disease. Recently, I was actually talking to my attending once a day, and then I asked him, we don't have any, many peripheral, disease patients. He said, did you ever try to ask them, like they have difficulty in walking? And they go with these complaints to the primary physicians, and they address them. They address them as, the muscle pains and all the time. So most part of these, coronary artery disease have actually are vasculopathies. Actually, they have involvement of, vessels of the legs.
Yes.
So I started inquiring in my clinic, these patients, and they started coming up with all types of complaints like claudications, the swelling in the legs because of varicosities. So I think we are missing a lot of the part of the training.
And not screening by just asking a question.
Yes, simple questions. Yeah. I think we can easily screen them, and we found many people are having vasculopathies of the legs and other extremities. But I think this generally helps. If you put your finger on the pulses, which we should put our fingers on all the pulses, and we will find that people have differences in the volumes in different pulses as well. So this has opened my eyes, and I feel like the training should have a good peripheral vascular training in the program itself.
Yes. So that's inspired you to choose or pick a place where you can get exposed enough for endovascular therapies as well.
I tried. Our program has a rotation. Actually, the next program I'm going to has a rotation outside the program for a month, so that you're exposed to the peripheral. I think it should be a comprehensive part of the program itself.
Yes. Yeah.
So,
but as you said, the PAD is it's a pandemic. It's available everywhere, but it's a problem. Usually, patient comes late, where we're ready for amputation or too far CLI.
Yeah.
We cannot salvage that.
Yeah, I agree with this point, because patient always think that, if he walks less, he can get better, and he does. So he doesn't present with the right thing.
Yeah.
I think when we have chest pain, we are very cautious because we may think that we may die, because if we have left pain, we think that we may not die at all. Yeah. So that misconception is still there among patients as well. I think more patient education is also needed, and education of the practitioners as well as cardiologists, as a peripheral, primary physicians as well as needed as well. Because if we are more well trained ourselves, we can teach people, we can educate the patient and the primary physicians too.
And how did you hear about CVI?
Oh, CVI. I was looking at your few YouTubes, and you have been, interviewing everywhere. So CVI came as a part of my, knowledge from the YouTube, and I said, actually, this is a right conference for the fellows to go in, and it's a better training program. How can I make my training better next year?
Yes.
And how I can, stimulate myself this year as well.
Absolutely.
To streamline according to the program and figure out how can I fulfill that peripheral training, which I may not get, rightly. But I think this is quite fulfilling.
And there is a dedicated track about structural, endovascular, and coronary.
Yes, and then see my interest, where do I lie as well.
Absolutely,
so
yeah.
This is a really great conference for fellows. I think we are not well aware, but I think I'm going to spread it out to my program and to other programs around.
Thank you.
So that more people, more fellows come in. Yesterday was a great fellow teaching program, and I enjoyed it. I learned a lot. It was quick, fast, and good learning experience for me.
That's great. Well, thanks, Dr. Banga, for being with us, and thanks for coming to CVI. Please watch these videos and others on the YouTube channel. This is Shadi Reis from Austin, CVI 2023.
Thank you
so much.
Thank you, sir.